So I guess the first few structures that we'll talk about when it comes to like treating low back pain is, again, identifying what type of low back pain we're treating, because if you're treating what we call a facet joint issue, you can have a little bit better options than
I feel good.
you
my
can
adductors
with
are really sore,
this.
so I
But
feel it in the
we'll start with like the
bottom,
psoas and the hip flexor, or I guess you could say the rectus femoris.
Yeah.
So,
But that's really
you guys want to be
yeah,
a guinea pig?
and same on this side, but a little more hinge.
So I'll show you things from like as simple to as complex as possible. A lot of that stuff would probably be a little bit more review for you guys, so it's kind of like fun. You guys get to play around with different like movements. So I'm gonna go over here onto your back for me. So when it comes to, we'll talk about rectus femoris, that long muscle that comes across the knee to the AIIS. So what we're gonna come here is we'll come down, and then we'll come down like right into that attachment. So if you can't feel it, you'll have him just kick up a little bit into your hand. You can feel it kind of pop up right away. It's like the first thing that will pop up. And what I like to do is just go slightly medial to it. Right, so I'm going to go here, I feel it pop in, you feel it pop up. I'll go slightly medial to it. As long as I'm not on any structure that's pulsing, essentially we're good. And you can do something as simple as this. Keep your thumb straight and just have them internally and externally rotate to help release some of the hip flexor. And remember, the reason we're working on the hip flexor is really just to help their spinal hinge move into a hip hinge. So I think in terms of lower back pain, the biggest problem, like we said, is people spinal hinging and not hip hinging. So if we can get some of those hips to rotate properly, to move, to glide, to slide, and to take pressure off of their spine, you're going to end up noticing that they feel better. So you can kind of feel like as they go a little deeper.
Yeah, and a tight reaction, that's what you want.
That can pull into your anterior pelvis. That can pull them up. They can keep that.
People are more likely to just
or like, you know, a lot of times people, like I told you that in intelligence, they'll be like this. They'll be kind of like stuck like this, and so their hip will be pulled forward. Their rectus femoris and their psoas are going to be tight as a result of that, which will then pull that pelvis up, and then they'll start feeling the tension in the hamstring. So is it a nerve, or is it the fact that their pelvis is kind of like rotated like this, and they're kind of like walking like this all the time? So for that reason, I actually don't even really mess around with the hamstring. Mostly on the first visit, I actually don't even mess around too much with the spine on the first visit. Because I want to show them that their spine is actually not the problem. It's their hips that are a problem, but the spine is so neurosensitive that it's actually having the issues. So that's one easy way, and then we can kind of just go back and forth. And I'll have you work on him and vice versa. It's pretty simple. So we'll come in, come in, just side to side. This is a simple way of doing it. And then we can get a little deeper, like more medial, like to get on the trochanter part. And we could just kind of move around. And this is it. This is something very easy. It's a quick win. You don't need to be the best manual therapist to learn how to do it properly. And what you're doing is getting some hip motion. You're getting some release of the psoas, the pelvis, and you're taking a lot of pressure off of that person. And it's like not a lot of movement. So like if they do have a hot low back and it's really pissed off, you're not going to really cause a lot of jeopardy here. So I'll have you come in and work on that, and then we'll kind of break it up, and then we'll flop, and then we'll kind of go through a couple. So we'll do one at a time. So what you want is the ASIS here, and then you drop down a little bit further into the AIIS, the inferior spine, inferior iliac, and then you'll come in, and then you'll just place your hand very gently there, and then you'll have him just kind of lift his leg up into the air, and that's it. That tendon that pops out is right there, and then you're gonna go slightly medial to it.
Well, what are we
Lift your head up or hip up. There you go. You feel it pop up into your hand. Very easy to find, right? And then you can kind of come back down, and then just
Like,
try
okay,
to,
it should be
so
like,
don't
like
be so
try like
close.
doing a
Just
session.
kind of keep that
Practice between
almost like this. Does that feel like what I was doing? Good, and your pressure is kind of like a little bit this way. And that's it. Like all you're doing is just like, and you can feel it. Like you can kind of add, as you externally rotate, you can give it a little more pressure, and then take the pressure off, and then pull a little more pressure, and then back off. You can kind of do it. It's really comfortable.
Yeah.
You know what's going to happen. It's very predictable, and it's not going to cause harm. So pretty easy.
Yeah.
And you're getting some shearing effect of that side joint, so it's really kind of fun. You can really help the hip that way. While the person's in this position, I'll do, I guess I'll go through two. I'll work on two different muscles. I'll go through a distraction technique as well. We did this with Jonathan, but I'm going to show you a different way. So I like to semi-sit on your foot here, and I'll do this. And a lot of people will just do this, right? Doesn't feel like a lot of pressure right now, but what we're gonna do is we can go lower, we can go grab and scoop and pull. And you can feel a lot of hip distraction, and I'm just leaning back and holding this back. You can feel a lot of hip distraction. You should maybe even feel that kind of come up through the back a little bit. So there's a lot of traction going on here. And I can wiggle a little bit, shake a little bit, and I'm just holding this position. I'm not gonna like go aggressively because we don't want that fascia to like slingshot it back. But you'll find that a lot of disc patients will really, really feel really nice, especially hip issues. If you want more of a femur type of traction, you can pull this way. You can do kind of this, and come here. We can kind of do this and stabilize, and I'll show you that, guys.
Yeah.
But this is more for the hip and the lower back at the same time. So we'll do that one, and then we'll follow. So you're gonna semi-sit on his foot. The reason I semi-sit on the foot is like I block it. I remember a patient, so I used to do this, like this. Let me just show you how I used to do it. This is, say he had a shoe on. I did this, and I was like all the way back, and I did sit on the person's thing, and they straighten their leg. Straighten your leg. Like, I went like that. I almost fell off. It was like my second or third year of practice. And I was like figuring this out, and this person didn't know what to do, and they just straightened their leg, and I almost completely fell off the table and hurt myself. So now I sit on their foot, so it's so they can't mess around and hurt you. And so.
I feel like we usually touch on it.
And if they have socks on, there's no way you're gonna get that slide. So you go ahead and sit on it.
That's really
So instead of just pulling, what I want you to do is figure out, like, think about like scooping into the thigh muscles and kind of like pulling it down. You feel the difference?
QL, right?
You can do what you're doing like this. You can do it like this. You can kind of like that. So now pinch your elbows. There you go. Pinch your elbows together. Yep. There you go. And now lean back using your good posture. Pull. Hold that sustain. You should feel like the hip is gapping. Hold it, hold it, hold it. Now hold it. Now grab a little lower. See how it feels. See, I see you're sliding a little bit. So like this now. Try this one. See this one. Yes. Ready? Scoop it. Now hold it. Your hands feel okay?
Definitely symmetry this way.
Yeah, try.
Oh, yeah.
Play around.
This one all the time.
There's no wrong answer on this.
Good.
You feel like it's somewhat similar? Should feel pretty good. You're getting a hip, you're getting a side joint, you're getting a lot of lower back. Again, this is good for lower back issues. So if you're manual therapist or whatever, you want to try to hold that for like 10 to 20 seconds, or just do a bunch of repeated pumps. Anybody can pretty much learn this one. These two that I just showed you. Let's flop and then see. See what
my shoes are?
Whatever you're tricky. It's his choice. It doesn't matter.
His contact point here, the sacrum, drag tensions,
So we'll do the rectus femoris attachment point first.
to strong tension, patient keep straight.
Like that, right?
Yep. So place your hands right there.
This is a separate room. Long leg.
So then we just lift his leg up in the air and you're good. You can pop in. See what that.
You go down. You go down.
If you can't get it
And
on,
then you just go slightly medial, like on it, but like slightly medial. If that makes sense.
Go forward. Okay.
So I'll do this to warm them up or to finish them off. You know, like sometimes like
That'll be okay.
yeah. So it's pretty easy, right? It's not hard at all.
Does that increase the pressure?
You can. So as you actually, Richie, you can do that little. Does it feel that kind of like?
Yeah, if it's,
No problem. As long as it's not pulsing, you should be good. Just you don't want to be on the artery there. So he's pretty good on this range. What I try to avoid is excessive, especially if they're really like in a bad acute state. I try to avoid an excessive, like he's really good, but excessive movement where this starts to come off the hip, because then they're going to start countering, like to pull themselves back, and then they're going to start using the lower back to kind of. So that's one of the reasons why I will also be here, and I'll just kind of stay.
So I'm drawing this up here.
we don't need that much.
Yeah, like I'll just kind
Much
of.
there.
Yeah, I'll just kind of go back. So his is pretty good.
Yeah.
it feels good.
You're just trying leg yesterday.
Yeah, so
Might be tough.
this is pretty good on you. Then let's do the traction thing.
So now,
Do either leg.
I'll start to flex your hip.
So slacking it.
So let's semi-sit on his foot. And sometimes you may have to go a little further.
Scoop some skin first.
Yeah, see how you did that nice scoop? That's what you want first. And now, instead of pulling upwards, go ahead, do it again. Do exactly what you just did. Now sit back on your butt and now just lean back. Straighten your arms a little bit if you can. And just lean back. See how he kind of like traction off the tip? Do you feel nice hip traction here, a little bit through there? That's it. Pretty simple there. So you get a lot of people out of like feel some immediate relief of pain just by doing like maybe 3 or 4 sets of like, you know, and
That
then
was my extra.
waiting a minute, like, hey, we're gonna wait, 10 seconds, and then we're gonna redo this again.
Yeah.
How's that feel? Blah, blah, blah. Let's also talk about, I guess, exercises. I told you guys about the Mckenzie Extensions that I'm friendly with, so to speak. I really like those.
That's the one where you're like
The
this.
press-ups.
Okay.
So did you go through that?
I don't think. Was that last week?
A couple of weeks ago we talked about that.
The
Didn't know.
Cobra one?
Yeah, the Cobras. So let's go through some
I know what
cueing.
those are.
Yeah. I'm a big fan of this for like sciatica that goes down the back. I'm a big fan of them. I think there's a way of cueing it a little bit, so I'll give you some of my cues that I think are good. So let's go onto your belly. So actually, you're a little bit taller, so we may have to go on the ground, or we can go on here. But that's I think we should go on the ground here, or we can go on this feet down here. Actually, that'll be better. So what we'll do is we'll lay onto the ground. We'll do phase 1, phase 2, and phase 3. Phase 1, just so you know, we would normally do this on the ground, but just for demonstration purposes, we would go up into here. So let's just bring your arms up to here and just kind of hang out here for about 20 to 30 seconds. See if they can tolerate it.
Trying to keep the flexion as high as possible.
Yeah, and so what we're gonna tell him to do is just completely relax your low back. Just hang out here. We're gonna just sit here and talk for about 15 to 20 seconds, maybe 30 seconds. And I just wanna let you know, we're gonna stay here for a little bit. And if you have increase in pain, you just let me know. There's only 3 things that are gonna happen in these series of exercises. You're either gonna get the same, you're gonna get better, or you're gonna get worse. That's it. If you get worse, please tell me right away. If you feel the same, that's okay. If you feel better, great job. We'll keep going. So right about now, I'll ask them, how are you feeling? You're like, hey, this feels fine. Okay, let's migrate up. You passed level 1. Let's go up to level 2. Level 2 would be like onto your elbows. I'll call this TV watching position or coloring book position or reading position. Yep. So we'll hang out here for another 20 to 30 seconds. All I want you to do is focus on relaxing your back. I will place my hand on their low back and I'll do this.
Neck just be like neutral or
Yeah.
extended or just pretty neutral.
If they can pass this, after 20 to 30 seconds, I'll have them come all the way down. After we say all the way down, I'm going to have you do a press up. So what we're going to do during this press up is you're going to press up only to the point where you're comfortable. Some people like to push up as far as they want, as far as they can. I don't care about as far as you can go. I only want you to go as far as you can go till you feel relief of back pain or feel relief of discomfort or you just feel comfortable. You should always be comfortable 100% of the time. I don't care if you go this far, I don't care if you go this far, okay? The number one goal you want to do is just relax the lower back, keep the pelvis on the floor. A lot of people will ask me, should I contract my butt? Should I have my feet pointed? Or should I have it doesn't matter about the feet in my opinion. I find that more people actually have more pain when they contract the glutes, believe it or not. It's because I think they're trying to tense up the spine.
Yeah.
Because it inherently has to tense it up, yeah. So I find that people will just relax better. So I'll place my hand here and I'll just have them go up. So try to, there you go. Is that comfortable for you? You don't have to go all the way up, just so you know. Okay, come back down. And back. So you're gonna hold for 1 to 2 seconds. And then what I want you to do is when you push up, try to really focus from here. I say frog on a lily pad, you know, play around with arm positions or something like that. I'll have them do 5 in a row. We're gonna do 5. Push up and come back down. Good. So you're gonna push up, hold for 1 second. Good. Try to relax this the best you can. I'll rock them back and forth. It's really more, it's actually more extension that's being accentuated down in the low back. That's why you're keeping the pelvis flat. And that's why you keep doing this, is so that you really kind of make them keep their belly button, so to speak, on the floor. Even though the belly button does come up, like, but it kind of gives that visual. So once we'll do 5 from here, they'll say, hey, I feel a little better, I don't feel much change. I'd like to at least do as a minimum of 10 to 20. Absolute minimum is 10. Like 2 sets of 5, just to see how they can do. The second set of 5, I'll tell them to play with hand positions. So can you do a little wider? Can you do it forward? Can you do back? And all the other things. There should be no reproduction of symptoms at all. To get out of this position, in this, we do this on the floor, but I'll have them Superman or Superwoman out with one arm, and then just roll to your side. I got you. That's how they'll get out of the position on the floor. And they'll get into like a fetal position and then go back in. Obviously we're on a table, I don't want that. But, so we'll do that again. The next exercise I like is a hip hinge, which a lot of people are, you already know, you probably already know as well, but let's come up. But I'll just tell you how I cue it. And you can kind of come up with your cues. So the first thing I'll do is I'll tell patients to come in, like we want to, so first, like the first day I probably will only give them their prescription of this Mckenzie extension if I feel like it's necessary for them. I'll do the extension for them. I say you have to do it 4 days in a row, maybe 3.5. If I see them in 3 days, I want you to follow up in 4 days. The reason I say 4 days is because I want to know if I'm changing anything. If they're getting results, then great, then I know I can go with my next series of exercises. Yeah. And then on day 5, they can kind of completely rest if they want, or do whatever they want. But I want 4 days, 20 in the morning, 20 at night. Anything else is a bonus. You can do 5 sets of 4, 4 sets of 5, 2 sets of 10. I prefer not to do 1 set of 20. But if you go on the floor in the morning and you do 20 repetitions, great. And you do 7 in the afternoon, fine. Just make sure you do 20 at night. The reason we do 20 at night and 20 in the morning is because the disc rehydrates and it has a lot of swelling and compression. And that's why most people feel a lot more complaints. So assuming you've done this for 4 days in a row, you're starting to feel a little better, like, holy crap, this actually is working. I'll tell you, after we're done with this, like, sprinkle it in, like 2 to 3 days a week still. We're not done with it, because you still need to decompress it, but you don't need to be as aggressive anymore. I just wanted to make sure I was right. So the next thing I'll do is teach them how to hip hinge properly, because Again, we want to teach them how to turn on the glutes without doing this, because they tend to overextend the spine and they don't have good hip mobility yet. So if they have bad hip mobility and they're doing this, they're going to end up doing that movement from the spine, which is the whole darn problem. So why don't we get them to learn how to actually do functional stuff like pick up bags and shoes and things like that, and kids and all these fun things that we need to actually pick up in this position. So I'll tell them, march in place, stop marching. You know, somewhat like almost like a squat type of stance. Get into an athletic stance. People know what that means. Okay? Things like this. And then what I'll do is I'll tell you, I want you to, you ever been in the ocean? Everyone says yes. You ever been in the ocean, wave comes up, washes over your feet, and then your feet get like locked into the like the sand? I want you to kind of wiggle your feet into the ground, and now your feet are absolutely stuck into the ground. Like cinder blocks, right? You're completely stuck into the ground. You can't move. Grip the ground with your feet. So really you're focusing on like frog on a lily pad again, but you're gripping the ground with your feet, and now you're in this position. I want you to focus on not rounding your spine and on just using your hips and your knees and keeping your spine nice and straight. From here, what I'll tell people to do is, this is the biggest mistake you'll see, and this is where I learned this. It changed my game. Is a lot of people will say, I want you to laterally rotate, or I want you to flare your knees out. Look what happened to my feet when I flare my knees out. How can I keep my feet straight if that's not possible? So what I'll do is I'll say instead, rip the carpet in half. Rip the carpet in half and hold. And so when they do that, I'll ask them where they feel it. So what I'll have you guys do, you could be shoe on or shoe off. I'll have you do that. So let's go ahead into this hip hinge position. Lock your feet into the ground, right? So however you're comfortable, lock your feet. Grip your feet into the floor. Bend your knees, bend your hips. Keep your spine nice and straight, looking straight ahead. And now what I want you to do is rotate your feet out. Look what happens to the feet. So look at, like a lot of people say, contract your knees going outward, right? Or whatever they say.
Yeah, spread your knees.
Spread your knees. Like what that happens, that disengages the feet, and now you completely have this chain that's like stuck up like this. How can you do that? You can't. So instead, think about this. Take the carpet right in the middle, try to rip it in half. And now you too as well, try to rip the carpet in half. Go ahead and hold, rip it in half, really rip it in half. Grip the ground with your feet, rip the carpet in half, rip the carpet in half, and release. Where do you guys feel it?
Glutes.
Good.
A little bit of adductors when I go into.
So that means and then I go like this. High five, you're doing it right. You get a high five too. So that means you're doing it right. Because at first, when they're doing it wrong, when they do this, they'll start feeling it, like because they're overly rotating, they'll start to use these to start really gripping the ground, and they'll start feeling it. A poor person who doesn't know these movements may not know how to grab the grip, so they'll feel it in the peroneals. If they don't, they'll feel it like through the lateral thighs. I'm like, okay, we're getting there. Do it again, and then they'll say, I don't really feel it. Do it again. I don't really feel it. And it'll start creeping up that way. It just means they need a little bit more time to fire their glutes. So what I'll do is I'll have them do this. 1, 2, 3, maybe 3 seconds or 5 seconds, whatever. Just getting the glutes to turn on while they can actually stabilize the spine. It makes complete sense. I mean, you're really creating a fault. You're changing their movement pattern, and you're activating the glutes without compromising the spine. So now they have a Mckenzie extension, which is relieving their pain and decompressing the disc. And then now they have a movement-based pattern that's getting the glutes turned on, the hips turned on a little bit, and they're actually not insulting their spine any further. And then at the same time, you're releasing their hip flexors and all these other things and tractioning the spine to help create more mobility, and that helps you help them. So, I mean, that's pretty much my day 1 and day 2, minus some other things. But, like, those are, like, my cues of how I say it for like, hip hinging. I think that's important because the ripping the carpet in half, like rip the yoga mat in half,
Yeah.
is a very good representation of how to like activate things. So
I like the feet on the sand cue too.
I think I just came up with that randomly.
It makes sense. It really takes you back to thinking about when your feet are locked in.
Yeah, because everybody
It's a
does
really
that. Even
similar feeling.
It is.
Yeah, when you're rooting properly.
and then like if the ocean came up and washed your feet off like this, and you were like outside like this, you would just step out and then let the ocean come back and then like rip you, and you would just sit there and watch the waves like this, like nice, and you would end up like fighting the wave like this. You wouldn't fight it like this because you'd be all over the place.
If anything, you assume in athletic.
So it really makes sense. And then so once they are locked in with the ocean and the water or whatever, I said now your feet are cinder locked in. They're done. You're stuck. You're not moving until we finish this exercise.
You like starting bottom up.
Yeah, exactly. Bottom up. But the whole goal is to get these firing. I don't mind getting these firing with other ways, but I just find that this is the most effective way. There was a pregnant individual that I saw who was having sciatica, and like all the hip flexor work that I did, some of the psoas work that I did, didn't really make a big difference on her. All the other things I did on her, she can't go on her belly because she's
Like
pregnant,
review the week after.
and like she can't do the extension. So I
That's
said,
the way it was,
let's
where you,
do
like, had to take her through the first
this
time.
exercise, and it immediately relieved your pain in that position.
Then 2 weeks ago.
So if they are having a lot of lower back pain, you can have them hold onto a pole, hold onto a rig, kitchen table, dresser, like, and have them stabilize. They don't have to be here or here, you know, have them do this.
So no, for sure, this is.
It makes a big difference if they just, because that'll offload their spine a little bit. Just like 5 or 10 or 20 pounds of pressure makes a big difference. If they need that cue to help them, like, I'm down with that.
Yeah.
You know, as long as it helps them. You cannot go further than this, in my opinion, if they can't learn how to activate their butt. Like, yes, you can still do more hip flexor work. Yes, you can do some more lower back or whatever you want to do. But you cannot really, you can't really retrain them in terms of like strength and conditioning. Like, if you told me how to squat and I couldn't even like bend my knees and my hips, like,
You're aggressive.
you'd end up putting that person into pain once they do squat, or you break their ankles. You break their ankles or their back, right? Like,
That'd be done. That'd be it for me as a trainer.
or it wouldn't be it for you as a trainer. It would be it for you as all their referrals and their clients, because they would never come back to you.
Sure.
So if you can get them to get through phase 1, okay, we're gonna do some hip work. We're gonna get them to extend for 4 or 5 days. I want you to follow up. If they're doing great, congratulations. Then you move on to this exercise. Sometimes the extensions don't work, and I'll still add this exercise anyway. And I'll still say, hey, we still need to retrain you, so you're gonna need to learn this eventually. So as a minimum, absolute minimum, you got 2 days worth of like retraining them, and you continue to work on their hips and their pelvis. And do some traction therapy on them or whatever, and I'll show you more traction methods too.
Now, as you like get more or like later appointments, is the hip hinge something you build upon? Like, let's say like we do a full squat or deadlift.
Yeah, but they have to be able to pass certain things.
Yeah.
So they have to be able to go like further in depth. They have to be able to do like, that's when I'll start adding core and cross crawl patterns after. So that would be day like 3 or 4, like, or because personally I don't see a lot of disc patients often. Like, if you're really aggressive, like, I'll see you twice a week. If you're not, like, 99% of the people or 95% of the people I see are show up once, show up in 4 days, and then I'll see you once a week after that. Because they have enough exercises to do in between that they should be doing that. So that being said, it's like, okay, so now we'll add maybe a side plank. We'll add maybe like more advanced glute work, or we'll add more
maybe even just awareness of bracing. So.
Possible bracing, and yeah, so I might even do that in the like, let's just say I want to see your hip hinge. So go ahead and do a hip hinge. Let's just say you're doing it properly. you're tearing the carpet apart. Now what I want you to do is don't go so far down. Look like a little bit more neutral. I'll place your hand here and I'll be like, hey, I'm gonna smack your stomach. I just want you to be a little more firm here. Good. So this way they know that when they're doing a compound lift, we have this thing mapped out for them. Like, you want them to go squat. I want them to go back to whatever sport they can do. And if they can't do a hip hinge with bracing, they're not going to be able to do anything that we ask them to do. So I will maybe hit their belly a little bit and say, hey, I'm going to tap your stomach. Make sure you tell them. And like, you'll brace their spine and like, hey, I'm going to tap you if you're done. I just want to see. And then I might like feel just to see where, like, are they contracting a little bit more on the right? Are they kind of like this way? Most people will be fine, but like, you're like, yeah. Or they may be like this. Flaring out, rib humping. So you'll just be like, hey, bring that back down, brace your core, brace your belly. I'm gonna hit your belly and tap your belly, and that might actually help them a lot. Yeah. So that's a way you can check to see it, and then you'll ask them again, where do you feel it? And they should still say they should feel it here, but they should also still feel it in the butt or the glutes there. That's on week 3, I guess you could say this now, or week 1.5. Yeah. Let's just say this is week 3, session 3. I'm going to start adding more than likely some core-based exercises that are not sit-ups ever, not toes to bar, nothing like that. Planks are okay. I personally do what we call McGill's Big 3, which is the reverse sit-up, the side plank, and then I like to do the bird dog. I probably won't give all 3 of them at once. I will probably test them in all 3. If we're doing a 40-minute session, I'll probably do all 3. If we're doing a 20-minute session, which most people do financially because it's cheaper, I'll only give them 1 or 2. And then I'll say, hey, here you go. How was that exercise? And they have to work on that exercise or those series of 3 or 4 exercises for the remainder, I don't want to say of time, but for a while, until they can get enough strength, low back endurance, glute endurance, movement. And all in the while, by the way, like, when they keep coming into you, you're not only giving them different exercises, but you're going to be working almost the same hip mobility problem. And then they may come in like, hey, my back is a little bit sore, and you might work the multifidi, kind of like what Jonathan does to you. And that's when I'll start getting into like multifidi, is like week maybe 2 or 3, session 2 or 3. Yeah, well, but I need because if they can't bend forward to touch their toes, like because of the sciatica coming down the back, what makes me think that they'll be able to tolerate this movement?
That's true. Yeah. Makes sense.
They're just shoving that disc backwards. They're not going to be able to do this type of movement because they'll be guarding. They'll like this, and what they may not do is they'll do this, and you'll go to this movement, and then what they'll do is with their leg they'll kick back into you. They won't even engage here. They'll actually just kick back into you. So you'll go in there, and all that pressure will go right back under your thumb. And so I don't need to hurt myself trying to help them when I already know they can't do this.
Yeah.
And not to mention, if they can't do A or B, in my opinion, then they haven't yet earned the right for me to work on these deep structures because they haven't gotten out of enough pain and they're not retraining their patterns yet. Then when I do this work, everything I just did and then everything I continue to give them is much more effective because now you're doing neurologic resets to the soft tissue. You're making things glide and slide better. You're aligning their hip and their pelvis. You're tractioning their spine, and you're retraining them. And if they flare up, they slip and they fall, they roll their ankle or something like that, and they like catch themselves. Good. Go back on the ground and do your extensions again. Now they have a awareness of what the heck is going on, what relieves their pain, that's their safety net, what actually helps build their hip hinging and their motor pattern, and then what you do to help increase their mobility.
That's a big thing, just creating that initial awareness so they know when they're not here.
It's really tough because like the mobility part is like I think a lot of patients come in and they look at you and they say, well, why the heck are you keep doing the same thing over and over and over? I'm like, well, like it took you 17 years to build this problem.
Yeah.
and now you want me to like just fix it in 4 visits, and like yet you're not necessarily doing everything we're doing, and yet you reduce your pain by 97% in 4 visits, and like we still have a lot more work to do if you really want to like get out of pain. And because pain is here, most people just want to get out of pain. When they fall short of pain, they fall right back into pain. But if you say I want to run a marathon and they fall short, they're running 20 miles. They're far away from pain. You know, so yeah, exactly. So it's like, hey, I want to squat 100 pounds. They're like, dude, you set the bar really low. Because if we all fall short of our goals, well, then now you're only squatting the bar.
Yeah.
With good form. Well, what if I say I want to squat 250 and you're like, I fall short and I squat 190?
Yeah.
That's pretty damn far away from the bar.
True.
Because, by the way, it's 190 plus your own body weight. People don't realize that. You know, people don't realize it's 190 plus your own. I'm going to show you a couple other tractions that I personally like to do with patients in the face down position, and I'm just going to show you traction because I do this on almost every visit to every single buddy because of like especially low back issues. It doesn't matter what kind of low back issue they have, I'm going to be doing this because this decompresses the spine. So let's go into your belly. We'll do that, and then we'll finish off. So there's a couple ways we can do this. First thing is we can kind of stabilize the pelvis here. We start pushing down, like not we're not doing just straight down. We're doing inferior. As you can tell, it's not like this. And we're going to do that, and then we're going to just cross our arms and going up. So as I lean into you, so what we're doing is we're just doing a little bit of a traction. As I lean into you, I'm not using my arm. Well, I am, but I'm not using my arms. I'm using my body weight. You can feel that. And then I'll go to one hip on one side. Look, you just adjusted there. And again. So that's just one way. I personally love this way, where I'll take my hand on the disc level. I'll scoop in a little bit, and I'll just traction down. So I'm pulling down, doing the same thing, but I'm just tractioning down. I'll go to one side of the spine. I'll work my way up. I can be really isolated if I want, like right there. And I can just push and hold. I might even stay there, and I'll just switch both sides. I might do an opposite side of, just to help see where like I see like more restriction in the spine. Or if I really want to be more localized to like that L4, L5 disc, I'll just kind of like stay here. I'll just kind of like wiggle back and forth. And I'll just do this. You'll get a little hip traction in there too. Feels one thing they will say is, I feel a deep, dull, achy stretch, which is what you feel. That's okay, as long as you're doing it gentle enough where you're getting results, but hard enough that you feel the effect. So it really does feel good. So that's one way to get a spinal traction. So I'll have you do it on him, and then we'll flip, and then we should be done. So the first way was this one. Cross one. So you place your hand like on the top of the sacrum, very nice and firm, and all you're going to do is think about pulling this apart, like scissoring, and then see how you do. How's that feel? Good. Feels good. So really, what you're doing is separating the surface in between. That's it.
And then creating like tension in the skin, does that indicate you're doing it correctly? Or?
So you want to create like tension in the skin a little bit, because you want to feel that the skin glide up and then stick.
Okay.
Does that make sense? So like if I see the skin do this, right, which is what all our skin does, now I push down and I pull up, and now the skin doesn't slide any further. You can even feel it like this, the traction.
Yeah.
So that's what you want to do right there. So maybe with him, like in going through your shirt, it might be a little harder, but like that's why I like the other one better. But that's my personal opinion. So this one. But you feel how like my hand sticks to you. It's like I always say frog on a lily pad, right? Like a bug, bug on a leaf. Like I'm not leaving off of this. Like I'm just stuck. And then I'll work my way down. So I'll have you do it. It feels really nice. So start a little lower and kind of scoop in again.
Yes,
And
it's
just
probably
try not to
different.
push so far straight down, but more like this. More like this type of angle. So I want you to literally visualize the spine doing this.
That one's like that one. I think that makes you out.
Try to be softer on your
So
hand.
it has options.
There you go. How's that feeling?
Good.
I feel like a lot of
It's hard to be soft on your hand but firm, right? You know what I mean?
Really?
But that takes years and time and just doing
I
this.
think I've seen him do a lot of all
Just
this.
the pressure where your hand works.
I've showed this to a lot of different chiropractors and a lot of different manual therapists, and everyone's like, "What the heck did you just do?" And I'm like, "Just manual traction." Like, dude, my back feels amazing. Where did you learn that? I don't know. Just do it. I don't know. Just do it. But come on up. You'll do it to him, or I'll do it to you, and then you can see what it feels like. It feels the same. Some of these things I don't even remember where I learned. So the first one was the cross, where I came here and here. And all I'm doing is just traction. You're not gonna get as much movement in here. I'll go to one side, maybe back to the center, maybe back to one side. I would say like his right side needs a little bit more. You can feel like through here. And then I'll come in. Right, I like to start on the middle of the spine. And I'll keep this hand the same. And then I'll just do this. Okay, and then I will get off to one side of the spine. You can do the muscles too. Like, let's just say the person's having one side of right side spine only. Like, you can still do both sides.
Okay.
It's not gonna hurt them.
So if I want to find that tip,
I've never had anybody
I rotate battery
say, like,
Mm,
this didn't feel like it helped them a little bit. The question is, like, if somebody's really in a lot of pain, do you really want to decompress them aggressively? You might just want to do like a quarter like this versus this. You guys, I can go pretty deep to really get a maximal
so if you're trying to find
movement. Does that feel like they feel this dull AP stretch in there?
Below I find tension.
That means you're just decompressing the disc.
Slacking.
Is that what you're trying to
Yep. So your hand's gonna go like here,
And then if I want to bring it,
and now you just lean in and like kind of almost get like the chest to move. See how you're sticking now?
Yeah.
Once you get that initial slide, then you stick.
so you got your
And you can move your hand a little closer, and then because you'll end up here, and then you'll slide up, and then you feel that traction right there. I can feel that in the spine.
What was the direction?
Fold. Good. Now,
this is going to
and now do the other one. I like the other one. I think the other one's a little bit better mechanically. It's better on yourself too. Like you don't have to spend much time like that.
Chest is good.
Yeah.
I love the rotators.
Are they going?
So you're also pulling this down too a little bit.
They go.
Does that feel similar?
Yeah.
Kind of hold it now, hold it. And now what you can do is wiggle. Kind of give that little extra traction. Is that cool? Like where you kind of get that extra
We'll sit here.
movement.
We'll come up and watch movies.
One side.
Yeah. And you can even switch calves too. You know, keep your hand the same, switch calves. You keep this hand the same, switch calves. You can keep that hand on the calf and switch arms. You know, you can just play around and see which one. I just like to do center, left, and then right, or vice versa. Or if I find that there's more like fascial restriction, like in the lower back, I'll stay like more like left or right side. So that's how we'll do traction. So now we have a traction to do face up. If the guy can't or the gal can't go on their back, now if the patient can only go on their belly because of maybe they got stuck there or whatever, you can do a face down one. And now you guys have like pretty much programmed for about 2 weeks worth of exercise. And you don't need a lot because I find that just if you can keep it really targeted, you can eliminate variables. If you're doing 7 exercises and all 7 of them are great, but like you don't know which one's really making the change. Well, what if they can just cut off 12 minutes off their workout and just do 3 exercises that actually makes the darn work?
Yeah.
So why like follow the 80-20 rule, which is 80% of the results and 20% of the effort.
A lot of that is derived just from feedback, too. A lot of questions or.
And just getting the results. And like, so like I have like almost a systematic protocol now. If I can't get them like better in like a lot better in like 2 to 3 weeks, like 50 to 70% better in like 2 to 3 weeks, or at least some temporary improvement like that, then I'm gonna be like, maybe we need to get something done in the gym, maybe, or maybe like, hey, just maybe come in an extra time and let me see if I can figure this out. I just have such a protocol at this point that I know it works.
That's good. For both of you and the client. So.
Yeah, I mean, and then that's when I'll show you some exercises next, some core-based exercises, the ones I was talking about before. And then we'll probably do more manual work too. So I'll give you a little bit of what I actually do aside from this stuff. So now you're really like, whether you're a strength coach and you want to retrain some patterns, or you're a manual therapist and you want to do stuff, you have both now. So I complement them together. I don't just say, you do this,
Yeah.
we're separate. But that's also my scope of practice. Follow your scope of practice.
Yeah.
Always.
That's the cool thing about kinetic though is like if it's not out of my scope, I can just refer to someone in-house.
Yeah, and once somebody passes like what I call the functional capacity exam, or is close to it, which I don't do often because and we'll talk about this in the future, it's just like they're at a point where they can really get better and start getting back to full activity and like sport specific stuff, but they risk a lot of injury. And you really need to see a strength and conditioning specialist that can actually help them and help them with their mobility. Like to really get over a disc issue, a lot of people ask me like, how long does it take? I'm like, depending on what you're looking for. If you're looking to just get out of pain, probably 4 weeks, 3 to 4 weeks, probably, maybe 5. Typically, if you really want to start strengthening it up, you're talking about 4 to 8 weeks. And getting some things fine-tuned. If you're really talking about like seriously getting things like well and strong and like really, like you're talking about 5 weeks to like 10, 12 weeks.
I'm on my like 5.5 week. I'd say I haven't had pain for like 2 or 3 weeks, so it's all just like strengthening.
So you're like right on that target, and I it's such a wide overlap because of what's your fitness level? Have you never done fitness before? Have you never been retrained before? Have you done a lot of fitness but have really poor movement patterns? Do you have really good movement patterns, really good body awareness, but your hip is just locked up from all the exercise that you've done? You know, and then maybe it requires more manual work. Maybe you really have good core work, or you just have really a lot of pain. We can't get it to fire yet.
Learning that is just like observing your patient and just probably
and listening to what they have to say.
Yeah.
Sometimes, like personally, I want to talk because I know what's going on, but then I realize, like, holy crap, they're actually telling me something that's really important.
Yeah. Makes sense.
They're really telling me something important. I'm like, wow, and I'm like, let me just try this, and then you end up like, wow, that didn't work, or that did work.
Appreciate it.
Anytime, guys.
Good thoughts.
Nice and intimate.
Yeah.
Yeah. We'll be able to, well, you guys will have a jump start on everything compared to like everyone else when it comes to this stuff.
Good.